As you begin or before you begin, you are certainly welcome to introduce your family. The time
Probably
is
might
yours.
recognize them. They're sitting behind me. This whole slew behind me is the family. One couldn't get here because of a baby at home, but my wife, Lisa, right there. I should point out, I married her in the wisest decision of my life 40 years ago. And if I can just come close to being that insightful when I'm administering Medicare, confirmed by this committee, then I think at least begin to battle some of the challenges we will face.
Thank you. Please proceed.
Chairman Crapo, Ranking Member Wyden, thank you very much for inviting me to appear in front of this committee today. I've met with everybody on this committee at one point or another, and I'm hoping some of those conversations will inform the committee hearing. I want to thank President Trump for his passionate desire to make America healthy again and for nominating me to support that vision. I want to thank Secretary Kennedy for having the confidence in my capacity to make a meaningful and measurable difference in the health and well-being of the American people. Let me start off with one simple premise. All great societies protect their most vulnerable. And I would argue we are a great people. With that in mind, I commit to doing whatever I can, working tirelessly to ensure that CMS provides Americans with access to superb care, especially Americans who are most vulnerable, our young, our disabled, and our elderly. For me, this commitment has been a lifelong passion. My physician father, when he came here, when he immigrated, saw America as a beacon of hope, a land of opportunity where everyone's decisions mattered. That imbued in me a confidence that I mattered, that I had agency. For example, I was a student athlete at Harvard, Senator Wyden, like you. That was the original Make America Healthy Again concept, that you just would work hard, play hard, eat well, and watch your body thrive. But because of my experience in college, I was surprised when I matriculated at the University of Pennsylvania in medical school that there was no nutrition class. So because I thought I had agency, I ran for school president, I won, and I created that class. I became, as well, a student at the Wharton Business School, and while there, I learned the skills necessary to manage large organizations like at CMS, where we have nearly 7,000 folks, hardworking career civil servants, and 40,000 outside contractors involved with the delivery of our services. Next, I began my career at Columbia University. And for those of you who don't know where Columbia, the medical school is, it's in uptown Manhattan in an area called Spanish Harlem. At the time I was training, it was the murder capital of the world, an area heavily populated by Medicaid patients. And I saw firsthand how our services, our healthcare system, underserved these communities. So I went to work. I began developing high-tech solutions, life-saving medical breakthroughs, ranging from mechanical hearts to the mitral clip, which is a small device you can put into the heart without stopping the heart that fixes heart valves, and it saves lives. In one large study, 50% reduction in death at half the price. Those are the kinds of advances that I wanted to be involved in. But I also pushed for low-tech solutions, like getting my patients to use preventive strategies, healthier lifestyles in order to recover from the heart surgery that I was often performing on them. And then Lisa, my wife, and I started HealthCore, which is a teen foundation which has touched the lives of millions of Americans over the last 20 years. Senator Bennett, working in schools, as we discussed in your office, tirelessly trying to get young, energetic kids to play a role, college graduates, in the well-being of kids just a few years younger than teenagers. And all along, I was working hard to publish what I found. In fact, publishing hundreds of peer-reviewed academic articles in some of our top journals, a bunch of New York Times best-selling books, as Senator Crapo mentioned, and all of these culminated in the creation of the Dr. Oz Show. We hosted health advocates from all walks of life, and we did it well, which is why we won 10 Emmy Awards for outstanding work over the 13 years of the program. I share my story with you for a simple reason, to highlight that everything I have done in my life, educationally and professionally, has prepared me for this precise moment in time, which I believe offers a monumental opportunity and a challenge for us at CMS. My TV audience has heard me say this many times, but many of you are too busy to watch television, so I'll repeat it, that I believe that a physician has a responsibility to tell patients what they need to know, even if the message is uncomfortable. So here's some painful truths that should concern everyone in this room. I'll list them quickly. Healthcare expenditures are growing 2 to 3% faster than our economy. Not sustainable. The Medicare Trust Fund will be insolvent within a decade. That's the 2.9% taken out of your paycheck. Medicaid is the #1 expense item in most states, consuming 30% of those state budgets, and that's crowding out essential services like schools and public safety that many of you spent your careers trying to develop. A healthcare cost per person in this country is twice that of other developed nations. So it's not just about the money. We're already putting twice as much money into the system. Why is it costing us so much? Because of chronic disease. And those chronic diseases, and we made it easy to be sick in America, are linked to poor lifestyle choices, and they drive 3/4 of the $1.7 trillion that CMS spends a year to support Americans' health. 43% of Americans are obese. That's the major driver of those lifestyle chronic morbidities. That's quadrupled since I was in college. More importantly, we're twice as obese as Europeans. We're 9 times as obese as the Japanese. And 3/4 of our young people cannot even qualify for military service. Our maternal mortality rate, and I want to hammer this point home because we talked about it, and Senator Hassan, we talked about this, well, she stepped out, but she was there a second ago, it puts us in dead last place behind 50 other countries. Maternal mortality rate, women dying during childbirth. Medical errors, #3 cause of death in America. These are some of the reasons why our life expectancy is now 5 years shorter than comparable countries. This public health crisis threatens our national security. Why? Because it adds to the national debt that is defeating us from within, crowding out other essential services. And we are, in addition, witnessing fellow Americans suffering needlessly, which I believe is a moral failing. As a heart surgeon, I can attest that the most expensive care we give is bad care. You pay to do the wrong thing, you pay to fix what was done wrong, then you pay to deal with all the complications. It's immoral, it's wrong, and it's expensive. We have a generational opportunity to fix our healthcare system and help people stay healthy for longer. That's why President Trump wants to love and cherish Medicare and Medicaid, because he believes every American should get the care they want, need, and deserve. Now, to achieve this mission, CMS should work with Congress to find efficiencies that can help stabilize our insurance markets, which will make it easier and more affordable for Americans to adopt healthy lifestyles. I would argue, I know you all agree, America is too great a nation for small dreams. So here's some big ideas. I'm going to limit it to 3 so I can get to the questions that I want to pursue if I'm confirmed by the Senate. First, we should empower beneficiaries with better tools and more transparency so the American people can better navigate their health as well as dealing with the complex healthcare system we have created for them. As an example, I think President Trump's executive order on transparency shifts power to the American people. Let's make America great again and make it healthy again by informing people so they can be in charge of their well-being. Second, we should incentivize doctors and all healthcare providers to optimize care. But we have to do that with real-time information while they're taking care of patients and within their workflow. Artificial intelligence, I believe, can help. It can liberate doctors and nurses from all the paperwork, which, by the way, is as much time they spend on paperwork as taking care of patients. They should focus on patients as better use of their time. And third, let's be aggressive in modernizing our tools to reduce fraud, waste, and abuse. This will stop unscrupulous people from stealing from vulnerable Americans and extend the life of the Medicare Trust Fund. I ask your permission to start sprinting after these goals so together we can provide access to better care, deliver better outcomes, and make America healthy again. I look forward to your questions, and I pray for your support. Thank you, sir.